bottom-up approach. It's more building systems to be secure to begin with versus trying to add it in the tail end.
With the rise of health tech, med tech, how do you ensure the safety of patient data?
Again, it really is a holistic approach. One is identifying the amount of data that you really need. A lot of organizations, especially healthcare organizations, tend to gather a lot of data, but no one's really taking the time to see how much of the data is really being used. Is it really needed? Do you have to collect so much information? Do you have to store so much information for so long? And really asking those questions from vendors, from other clinics, from technology providers, what is really needed to get the job done, and how long do I have to really store this, and trying to minimize and limit that to begin with. Then once you actually have the data, identifying or classifying the data, not all data is the same. It's not that everything's equal. So, patient PII, PHI is definitely more, I would say it has to be protected at a higher level than, let's say, regular data. But even if there is PII, PHI, not even that's not all the same. Some systems, like an EHR system, yes, that has pretty much a comprehensive amount of PII, PHI data, so those definitely have to be secured at a higher level. But if you have another system that just maybe has a patient name, and then some other information, but you really, even if you figure that out or that system gets compromised, it's not going to be a devastating effect or a catastrophic effect. You really can't put that in the same category as, like, let's say, an EHR system. And then there's other systems that just have, let's say, financial data. And yes, it's sensitive, but it might not be as sensitive as some of these other systems where if the data gets compromised, it can easily be recovered. So just identifying the classification of the data and then try to figure out the best way to secure it. So if you're a healthcare organization, my guess is that you're sharing data with other clinics or other healthcare providers, or just externally from your organization. So you also have to make sure that you have good quality interconnectivity security agreements in place or MOUs in place, so you can really document what is the data that's being sent to this third party, how are they securing it, who on their side would you call if there's a breach on your end of the data, and if they have a breach, then who are they going to call from your side, and also keeping those documents up to date as well, because having a document that's 10 years old and maybe that person's no longer even there, it's not really going to be helpful if something does happen.
So that kind of tied into having a strong cybersecurity plan. But if there's anything else that you like, what does the ideal cybersecurity plan look like?
It's great that you asked that, because I'm actually coming up with one for where I am right now. So again, for me, I look at everything from a holistic and integrative point of view. So the CISO working in a silo is not really going to be beneficial for an organization. You really don't want a security official just telling other people what to do, or just coming up with all of these policies or tools and technologies on their own without collaboration among other parties. So you really need a strong CISO that works hand in hand with the CFO, with the CIO, the CTO, to do what's best for the organization as a whole, but also work with different teams, like the technology operation teams, desktop support teams, and if you're in a hospital or healthcare system, then I would also suggest working with patients as well, to educate patients on, hey, you're here for a hospital. Some patients might be here for a long term, but that doesn't mean they just get to do whatever they want on the on a network. So educating the patients on security and privacy types of topics, maybe having posters and constant things to engage the users. So it's not just the once a year security and privacy annual training that everyone just clicks next just so they can get it done with. It's putting out communications to your user base, on a weekly, monthly basis, just so security starts getting ingrained in their minds and making it exciting. Like for the NIH Clinical Center, which was their biomedical research hospital, I spent 8 years there before coming to this level. I created a security rap video for them. So just to, with common things to like do's and don'ts, and also putting the fear away from security, like we're not there to get people in trouble, or they're not going to get in trouble for letting us know that they might have accidentally done something. So we made it like a fun video, and then we had a email distribution list, and we just asked them, hey, any questions, just write to us, call us. You're not going to get in trouble for this per se. And that really opened the door to change the mindset of the C-suite, but also change the mindset of users, especially when you're talking about in a clinical setting. Driving the importance of security for a clinician is a little different than driving the importance of security for, let's say, a technologist. So when you're talking with the clinician, their primary duty is to take care of the patient, to do what's best for the patient. So, but adding in security to that, like, hey, we want to take care of the patient in other ways as well. Like, we don't want the patient data to be compromised. We don't want your system to be compromised, because then that definitely, you won't be able to provide the care to that patient. So kind of speaking in the language that that the person that you're talking to resonates with most.